Hi, I'm Lauren House, and for my personality project, I decided to do the free association, a therapy technique. So, the textbook definition of free association is the treatment technique in which the patient says whatever comes to mind. However, there is so much interesting history on the creation of the free association technique. Sigmund Freud developed free association in a long process from 1892 to 1898 as a way to explore the unconscious mind. From what we have learned about Freud, we know that his approach to personality was based on navigating the unconscious. It gave complete freedom for the patient to examine their thoughts with no prompt or intervention from a therapist. This is fascinating to analyze, considering what we know about therapy is that there is usually a lot of the therapist prompting someone to open up about their feelings and navigating a session. Freud would actually hypnotize patients. He would ask them to lie down on a couch. He would place his hand on their forehead and ask them the first thing that came to their mind. So, in free association, a person is encouraged to write or verbalize every thought that comes to their mind. The goal of free association is to find the links between different memories or emotions, no matter how random or bizarre they are, to find possible unconscious associations between these thoughts, memories, and emotions. It is possible that many patients in free association therapy will reveal repressed emotions in their unconscious. So, what happens if you were to decide to pick the free association technique as a client today? So, if you were to pick free association today, well, you would likely be conscious, not hypnotized. You wouldn't lie on a couch. You would probably sit in a chair while the therapist would sit in another chair. And it would most likely be a 50-minute time block. And you would just start speaking to whatever things came to your mind. Here is an example of free association. This is a client or patient using free association, and then I'm going to go over the interpretation from the therapist. So, lying on a couch in dim light and in a peaceful room, the patient produces the following free associations. I am thinking of the fluffy clouds I seem to see with my very eyes. They are white and pearly. The sky is full of clouds, but a few azure patches can still be seen here and there. Clouds keep changing their shapes. They are fluid because they are condensed water particles. I am thinking I may have an obsession about this water. The doctor has told me I am dehydrated. There's not enough water in my body. He suggests I should drink 2 to 3 liters of water every day, mineral water or tea. I thought there is a connection between my need to add salt to my food and thirst. My body has found itself a pretext, salty food, to make me drink more water. I have a lot of thoughts about my manifestations of my body, which seem logical and aim at inner balance. Everybody has, in fact, got an inner physician in oneself. What need is there of an outside doctor then? If you allow yourself lie at the will of your free inclinations with no assumptions whatsoever, you will have the intuition of making things that may surprise you, nevertheless useful to your body and securing your health and high spirits. I read somewhere that one can be one's own doctor. Everybody can be one's own doctor. So, the interpretation of this from the therapist is the fact that during her therapy, the patient alludes to a doctor who had, in fact, done nothing to help her is no mere chance. This memory can be related to the present circumstance, and it may be translated in the patient's skepticism concerning the utility of the analytic therapy. So that's just a little example of what a free association conversation between a therapist and client would be like. There are many different critics of the use of free association. There have been psychologists who have said it is neither free nor validating evidence for the psychoanalytical theory, that there is no way of knowing if it accesses repressed memories or imagined memories. Because psychoanalysis deals chiefly with unconscious motives and repressed emotions, common sense no longer seems to be applicable. Farrell and other critics believe that it is increasingly important for analysts to be aware of common sense and the role that it can and should and does play in psychoanalysis. Unfortunately, today's critics believe that free association is a failed therapy technique. Although there are critics of psychoanalysis and free association, it was made over a century ago and is still considered to be credible and effective method of treating mental illnesses, which in itself shows it still stands its ground as a therapy technique. And this is Mr. Fruit himself. I thought I'd add a picture in there. Thank you so much for watching and listening. And thank you. Goodbye.